Nevertheless, this is not complete repair, and also we would like to treat chronic spinal cord injury. And then it's no success if we just inject intravenously or intraspinal stem cells, because the axons cannot grow into this lesion site, and also there is a glial scar, which you will hear about a lot from next speakers. So we need to bridging the gap like this bridge. It's actually Italian bridge, and you see that then the axons and stem cells can cross the bridge and maybe make a connection in this both sides of the spinal cord. So that is research which is now in our lab going on for 15 years, and we have developed more than 15 different scaffolds which would make a bridge in bridging the spinal cord, and some of them are typical here, typical examples are here. Some of them are mimicking the brain situation, brain microenvironment, so like the cells and pores, the porosity about the same like in the brain, or some of them have oriented pores with different sizes, and their surfaces are covered by attractive molecules like laminin, for example. And then, last but not least, there is a very promising candidate, which is the nanofibers. Nanofibers, so far it's not easy to make them in 3D material, but we can do some modifications, but they are promising candidate because the cells life to grows on the nanofibers, and again we can cover the surfaces of nanofibers with attractive molecules, as well as we can put something inside the nanofibers which can be slowly released after implantation. So now you see our model of chronic spinal cord injury. It's again balloon-induced compression lesion. But now we implanted the cells 5 weeks after spinal cord injury, when the cavity is already formed, and we can do MRI and see how big is the lesion, and have exactly the scaffold with of the size of the lesion. So you see here results if there was only saline injection, and you see the spinal cord is severely atrophied on both sides and huge cavity, and there is no connection anywhere here. And if we stain for neurofilaments or axons, there is nothing inside, of course. Here we implanted the hydrogel, one of our hydrogel, which, however, if it's implanted alone, it bridges the lesion, but it doesn't lead to functional improvement. So our strategy is that we seed the hydrogel scaffolds in vitro with stem cells, various types of stem cells, and then we implant this combined scaffold. At least with these two players, maybe there will be a possibility also to include some inhibitors of inhibitors and some enzymes to clean the scar. But anyhow, here you see the successful bridging, and if we do morphometrical evaluation, we see the spinal cord is not so atrophied like it is here, and then neurofilaments are growing into the scaffold. So we can see the histology here, and we can see staining for neurofilaments inside the scaffold. This is a large lesion, it's about 2 millimeters lesion. And then you see the Schwann cells growing in, and colocalization, and then you see myelin fibers which are growing in are myelinated. And of course, ultimately, most important is what is the behavioral outcome, which I show you in a minute. Here, for comparison, and I have not much time to show you, is a nanofiber scaffold. And again, you see very successful bridging, not in magnification, but you see now GFP-labeled mesenchymal stem cells, which are green now. You see the blood vessels growing in, astrocytes don't grow in, and neurofilaments and Schwann cells, and neurofilaments and Schwann cells colocalized and formed in a parallel sort of fashion. So what is the behavioral outcome? This is most important. And you see here one trick. If you implant the gel only, there is some improvement, but not really significant. But if you see the gel with mesenchymal stem cells, you see the significant improvement. But the trick is that we cannot finish the experiment like people usually do after 2-3 months. We need to wait 4, 5, 6 months to see really the effect, which is understandable because the fibers cannot, after chronic spinal cord injury, regenerate so fast. So we see here the improvement, and again, in the sensory test, we see the post-sensitivity improvement. Now, in last minute, I will tell you that we are going to the clinical study because the patients are impatient and we are also impatient. It's not a very complicated clinical study, it's absolutely safe. That we proved now on 42 patients. And what they received is their autologous bone marrow grafts, only mononuclear cells. There were no manipulated T cells. They were only separated from erythrocytes, and so they are taken. Here to the rack from iliac bones, and then they are concentrated and adjusted to the volume, to very small volume, because we find out, particularly in C lesions, in cervical lesions, that intra-arterial application by catheterization of arteria vertebralis is much more promising than just intravenous application. We don't do the intraspinal yet, but we have some future strategies how to do it. But because there is a collaterals by Adamkiewicz artery from arteria vertebralis, the cells are injected in this type of application close to the injury site. Some of the preliminary result has been published. And you see few patients here, and that is cervical lesions mostly, and bold is whether some of the parameters of Asia score, which maybe you are familiar with, it's improved. So most of them improved, but slightly by, at least by 5 points or more. So in conclusion, adult autologous stem cells, mesenchymal or factory and glia can improve injury outcome and regeneration if they applied in acute time. Iron oxide nanoparticles can be used as markers in non-invasive MRI imaging, also in patients. Nanofiber scaffolds or hydrogels can bridge the tissue defects in combination with stem cells, growth factors, inhibitory factors as a future strategy for treatment of spinal cord injury. Implantation of mesenchymal stem cells used in our, mononuclear cells used in our phase 1 clinical study in patients with transversal spinal cord lesion, complete spinal cord lesions is safe. Application of arteria vertebralis is more promising, and 90% of acute patients were found mild improvement of function. And in preparation, in chronic patients, we will isolate cells, expand mesenchymal stem cells, and we will implant them in combination with the scaffolds to bridge the defect. So these are my collaborators. This is a paper where we published some preliminary results. You can find the method here, and then these people are working in a lab, also in animals, and there are people in the MRI department and people synthesizing these scaffolds, which some of them are patented and can be used for you. And there are 2 rescue and stem cell projects which were financed by EU. Thank you for your attention.